Our guest today is Cynthia Cohen, Director of Client Relations of Mother's Milk Bank Northeast. Cynthia's expertise in human milk banking comes from her 7 years at Mother's Milk Bank Northeast. As Director of Client Relations, Cynthia provides education and outreach to hospital and community organizations in over 12 states. Cynthia also manages all of the donor depots for Mother's Milk Bank Northeast. Cynthia frequently presents to staff in both NICUs and well baby units. She is an expert in developing donor milk programs in hospitals of varying sizes. Her presentations cover the instruction and training of hospital staff on the use of human milk in both the inpatient and outpatient settings, screening of donors, processing of donor milk, and the safety of pasteurized donor human milk. Cynthia can also address how to inform families about the safety and benefits of donor milk for their infants. And Cynthia is also the mother of triplet girls who are now 20 years old. So thank you for joining us today, Cynthia.
Thank you for having me. I'm really excited to be here today.
Awesome. Well, so to start us off, Cynthia, so let's start with the basics. So what is a milk bank?
Really big question because a lot of people don't know what a milk bank is. And I have to just say that there are so many times when I'm speaking in public about milk banking, almost every time there's someone in the group who says, I wish I knew about you when, because I had a freezer full of milk and I threw it all away. So painful to hear.
Pains me.
Yes, yeah, absolutely. I hear that all the time. So I'm so glad that we exist. So let me talk about our milk bank. Mother's Milk Bank Northeast is a community-based nonprofit milk bank. We provide pasteurized donor human milk to babies throughout the Northeast. In all honesty, we have sent milk throughout the entire country, including Hawaii. So,
wow.
Yep. Our mandated mission is to provide milk to the fragile and premature babies who are in the neonatal intensive care units. But because of our amazing partners in the community who help us with education and outreach to families, we have more than enough milk to be able to provide milk to the NICUs, to the special care nurseries, to the full-term units, mother-baby units, and to families at home. There are many, many reasons why families who are home with their babies need to use donor milk. And, you know, there are about, I think, 26 nonprofit milk banks, and we are all under the auspices of the Human Milk Banking Association of North America. We call it HABANA. And HABANA has really set the gold standard for milk banking in the US and in Canada. They have created the guidelines in conversation with and in compliance with the CDC, FDA, Health Canada, and other, experts in the field.
That's wonderful. I actually, when I worked labor and delivery on my most recent job at a community hospital, was my first time even having the opportunity to provide donor milk, donor human milk to my patients. And that was the 5th hospital that I had worked at as a maternity nurse. So I was psyched because it was utilized a lot. We had some really excellent IBCLCs that really helped educate everybody, patients and nurses about it. So I'm so excited that you're here today.
Actually, Melissa, I was actually just thinking too, when I was chatting with Cynthia before this, she was telling me about some of the area hospitals that do it and don't do it that I didn't realize. And one of the previous hospitals that you worked at has such glowing reviews in so many ways, doesn't use donor milk, which really surprised me. And it's just a testament to the fact that some hospitals do a lot of really awesome things and then sometimes they don't, right? You know, it's like...
Or like sometimes they do a lot of awesome things in the care of the mother in labor and then fall very short in the care of the postpartum couplet. Sometimes hospitals do a very, very good job keeping parents with their babies together and do not practice evidence-based medicine in labor and delivery. So I completely agree with you with that. Yeah.
I know we'll talk about it a little bit more, but I think there's misconceptions at hospitals about how much donor milk will cost. And I think they think it's going to cost them much, much more than it ever does. And just other misconceptions, which I know we'll talk about a little bit more as we go through. And I just think that there's, I spend most of my time doing education and outreach to hospitals and community organizations to try to let people know that what are actually the facts and what is evidence-based versus what are the fears or concerns that may not actually hold water.
Mm.
Absolutely. Let's start talking about some of those misconceptions right off the bat. I know that everybody in this call is eternally grateful for the formulas that we have in this country for those babies that need it or those parents that choose to use it, because we have access to clean water, healthy, safe, sterile, many times, sometimes not, but formulas to offer our babies. But there is a difference between human milk and formula. So can you describe a little bit about the difference between human milk and formula, and why is donor milk something that we even need?
Do you have days?
We have 1 hour.
Okay, so all right, so let's start at the beginning. Human milk is made for human baby. Like it is tailored for human babies. Formula is made from cow's milk. Cow's milk is made for baby cows. It is, it is genetically tailored. I don't know that it is tailored for a calf, not for a human baby. So when we talk about using donor milk, I'm never ever comparing it to the human. I'm never comparing it to mom's own milk. The milk that humans make for their human babies is tailored for the human babies. It has protective factors in it that don't exist in cow's milk. There are certain protective factors that are hundreds and thousands of times greater in human milk because the human babies need it. I mean, if you watch videos of maybe a human baby learning to walk, well, a human baby doesn't learn to walk until maybe 11 months, and a cow is up walking, a calf is up walking, I'm not an expert on this, in a matter of hours. So, human babies and calves need very different factors in the milk. Human milk is alive. It is bioactive. It has, it is literally tailored for the needs of a human baby. The best milk for a baby is the milk that mother produces in her own body for that baby. That is always best. That mom's own milk is always, always best for her own baby. So I'm never going to compare pasteurized donor human milk to say it's better than mom's milk, because mom's own milk is made for that specific baby. But when compared to formula is made from cow's milk. It has a lot of other additives in it too, and I'm not an expert on formula. And there is a time and a place for formula, there absolutely is. And there are many reasons in a NICU why a fragile and preterm baby would need milk. One of the biggest reasons, and there's many studies on it, is that often preterm babies can develop necrotizing enterocolitis, which is a very serious and often fatal disease infection in their intestines. There are many studies that show that pasteurized donor human milk can prevent necrotizing enterocolitis. It prevents a number of other issues, blindness, infections, sepsis. There are many reasons for fragile and critically ill babies that using pasteurized donor human milk protects their systems as their systems are developing, and that often their systems are not developed enough to be able to handle cow's milk in formula. And on and on. There are studies showing, reasons for using donor milk, in the well baby units. There are studies that show that there is increased breastfeeding when donor milk is used, that the length of stay in hospitals is shorter when donor human milk is used, that it's good for late preterm babies, for babies, who have a poor latch, where simply mom's own milk is insufficient or hasn't come in yet. And, especially now as families during COVID-19 and families are being discharged so quickly from the hospital, there's more and more reason for families to want to take donor milk home. Many, many families want to keep their babies on a human milk only diet, and they don't want to use formula. And honestly, formula or not formula is the family's own choice. And my babies got formula, but I have to say today that had had I known then, 20 years ago, what I know now, and if donor milk had been available, I would have made very different choices than I did. But
Yeah, a
and I'm
lot of
happy to be able to pass that on to people.
yeah, a lot of people talk about, well, I just use one bottle of formula, so it's not a big deal. And on one hand, if you can't get donor milk and you don't have your own milk, then your baby needs to be fed. So giving them a bottle or two or 10 or 50 of formula, if that's what they need to be fed because there isn't donor milk or your own milk available, absolutely. But what I'm hoping by the end of this whole conversation is that more parents will realize why they might want to ask or assert themselves or arrange for donor milk if just in case they don't have enough, because I know there's some really interesting information that I hope you can speak on about, the just one bottle. There's a whole article people can search on the internet about it. It's very scientific. But just the idea of just one bottle is the name of the article. What is it about one bottle that can be negative?
So you're right. There is an article by Marsha Walker which says just one bottle, and I think it's fascinating. And again, I just also want to say that not everybody has access to donor milk, or can afford donor milk. We do have financial assistance for families, but if you have access to your own human milk or to donor milk, the idea of just one bottle, as Marsha Walker talks about it, is it affects the baby's gut flora. It affects the baby's newborn microbiome, which is really a hot topic today. Everybody's talking about microbiome, and this is donor milk definitely helps to support that. It kicks in early sensitivities to cow's milk. There's an increased risk of diabetes. Babies have an immature immune, it affects their own immature immune and their own development. And then, in terms of the mothers, just one bottle, when someone says, oh, you don't, you're in the hospital and a nurse or someone says, oh, you need to sleep. Don't worry about breastfeeding in the middle of the night. It affects mom's own supply. Then she's not working on her supply to get her supply up. And those early feedings are really essential in mom developing her own supply. And it also affects her own confidence in her supply, and I can say for myself that, when we were in the hospital, I did not, I felt pretty ill after the C-section when 3 babies were removed, and I had a bad reaction to the medication given for the C-section. And for the first 12 hours, nobody asked me. There was no discussion. Nobody put my babies to my breast. They simply gave for the first 12 hours, my babies were given formula, which, my husband was able to give. So that was a bonding time for him. But, nobody was talking to me about developing my own supply. And, again, had I known then what I know now, I would have set things up differently. So.
And some people may think, oh, well, Cynthia, that was 20 years ago. I'm sure that doesn't happen today. Oh, but it does.
Oh, it absolutely does. Everything that you said, you need to sleep, just let me take the baby to the nursery for the night, or it's just one bottle. And that comes from sometimes nurses, family members, partners, and many times these people are well-meaning. It's not that they are trying to shoot your breastfeeding goals in the foot, but the reality is that breast feeding, human milk feeding, lactation, it's a supply and demand. And if we're removing that baby from that parent and putting them in the nursery and offering artificial milk, and that parent is not otherwise stimulating their body to make milk, that can really harm a milk supply, like you so eloquently said, Cynthia. So why are there milk banks? Your milk bank's called the Mother's Milk Bank Northeast. Which states get milk from your milk bank?
So I think, all right. So again, I'm going to break it up between hospitals and outpatients. So we have had a number of hospitals throughout the country. We primarily serve hospitals in the Northeast. So I think we currently have hospitals in Tennessee. We've had hospitals in Georgia. We've had hospitals all over the place. But we probably initially focused on New England and then spread through the Northeast to many different states in the Northeast for hospitals. So we also provide milk to outpatients. And so a number of other milk banks who we partner with who are amazing, amazing, amazing. Every nonprofit abandoned milk bank is phenomenal, and I can't say enough about all of them. That there are some milk banks who don't have enough milk for outpatients, and they have enough milk for their hospitals or their NICUs, and so they often will send some of their outpatients to us because families at home, for many reasons, need milk, and we have had again a huge outpouring of donations, which doesn't mean we don't want more. We are always looking for more donors. Because when a donor, when someone is donating milk to us, it's usually for a limited period of time. And so we're, continually doing outreach and education. I do outreach and education all the time to be able to bring, new donors in to just let moms know that it's even an option for them to donate. And moms should know that most of the milk does go to the neonatal intensive care units,
To the most fragile babies that really, really need it. So that is awesome.
Absolutely. And they're supporting moms, and the mothers are donating are supporting, you're supporting families, you're supporting the baby, you're supporting the whole family as a whole. It's just, there's so many people who feel so bad that they're not able to provide milk for their own baby. And we try to educate them and let them know, using pasteurized donor human milk is really just another form of breastfeeding supports and normalizing as such, because not everybody's milk comes in before they're leaving the hospital.
So I understand too that pasteurized donor human milk is what is recommended by the American Academy of Pediatrics, the Academy of Family Medicine or Family Practice, the National Association of Neonatal Nurses, the World Health Organization, and even the American College of Obstetricians and Gynecologists. So from what I understand, not every hospital has donor milk to give away, and not every hospital gives the milk to babies. So what's going on there if these big important organizations are saying that this is important? What's going on in the interworkings of the gears of the hospitals?
That's so much of what I do. So much of what I do is going to hospitals and talking to whether it's the neonatologists or pediatricians, nurse managers, unit directors, and even and the staff, the nursing staff, to educate everybody about why you use donor milk. Why is donor milk important? Why is it better for a baby than formula? And I'm talking to smart, educated, amazing, amazing people who do absolute phenomenal work. So there's a number of reasons. So sometimes it is really an issue of red tape. Hospitals are vast bureaucracies, and there's a lot
Great, Cynthia.
I think the people on the ground often, lactation consultants are often working very hard to want to set up donor milk programs, but I think oftentimes there are hospital administrators who believe that it's going to be too expensive, because often medications that maybe they're getting are thousands of dollars per dose. All the milk that I'm kind of cutting ahead of this, all the milk that we receive is donated, and the donors who donate to us are literally, truly our heroes. They are our heroes, and they are amazing. And we don't pay any of them. They do this simply because they want to help other families and other babies. They're doing it altruistically out of the kindness of their hearts, and they are beyond amazing. We do what we do to make sure that the milk is safe, because remember, our mandated mission is not the full-term healthy baby who's in the hospital for 2 days and being discharged with no issues. It is really that micro preemie baby who's in the NICU. And so we need to make sure that the milk that we are processing is safe for that baby. And that's really, really very expensive. And so we do charge a processing fee to hospitals and to families who are obtaining milk from us. But for hospitals, it's so much less than they could possibly imagine. One of the hospitals that we worked with came up and realized that for the average baby who's staying the average stay, that they were spending only basically $27 per baby on donor milk. And they are big, big, big users of donor milk throughout the NICU and the well baby unit, and they send lots of families home with milk. So it's really substantially less than hospitals realize. So there's a cost, it's a cost issue. It is simply working through the red tape of bureaucracy at hospitals, and some often misconceptions about the safety or the use of donor milk. Hospitals also really base their decisions on evidence-based clinical studies. And so there are many times where it seems common sense to us that human milk would be better for a human baby. Unless they're seeing a number of studies, it's not always so clear to them, I would say.
Although
and
I
there's
love
a lot
to
of hospital decisions that I can't possibly, understand.
I read an article, two different ones actually, and I don't know if they were studies or a meta-analysis of some sort, but ultimately one said that if hospitals who had NICUs, if they were to use donor milk for the preemies in particular they were looking at, that there would be 700 more babies that would live per year in the United States. And the other study said it was closer to 900. But like that alone, it seems, it's just, I can only imagine how frustrating it is for you and for the people in the hospitals that are working to fight for this so that parents can get access to it, especially if they work in the NICU and they see these babies passing away and they just feel like, oh, that baby would have had a better chance. We can never know for sure. But I also find it's frustrating too for the parents that I know personally. I'm sure you've heard from them as well, but if they had just told me I could pay for it, we would have paid for it. And that's not even currently being advertised if you're already at the hospital with your baby in the NICU or with a healthy baby. Either way, it's not really presented that way, which we'll get to, but it's very frustrating to me.
Yeah, I mean, I can't speak to that study. I would agree that I think it is frustrating for families. And again, that is why I spend so much time doing education and outreach. So, we have a program, and not all our hospitals use it yet, where families can privately pay for milk to be used either in the hospital stay if every hospital who uses donor milk sets up their own protocols and guidelines for which babies qualify for the use of donor milk. So that is nothing our milk bank that's not our decision, that's theirs. When I do education and outreach to hospitals, talk about all the different reasons why it's good for babies in the NICU as well as in the well baby units. So every hospital, I can't advocate enough for families, even, before you've given birth, call your hospital, find out, are you using pasteurized donor human milk from a milk bank? If you're not using it, can I bring in my own from a milk bank? Do I need to have it shipped directly to you? Can I have it shipped to me at home? And can I bring it in? The power of the consumer is huge. And for hospitals that don't have donor milk, complaining to the nurse, I mean, the nurses are amazing frontline workers, but maybe escalate it, talk to the unit director, talk to, the consumer affair, or not consumer, whoever
the patient relations.
Patient relations. Yeah. Speak up, make your voices heard. I think that there are very few NICUs that are not using donor milk, and more of them are coming on. I'm working with some of the smaller NICUs. We have another one coming on this month. I mean, it's very exciting. We've kind of a couple new NICUs coming on this month. It's very exciting. I think it's an issue, where hospitals are very concerned about the cost, and I think they're shocked when they find out it is not as expensive as they think it is. It's a fraction of the cost of what they think it will be.
The other thing to mention is that, like, for example, I know of one hospital that does have pasteurized donor human milk from your milk bank, and they only allow it to be used in the NICU. You can't have it if your baby is full term. But then I recently had heard from a family that there was actually a further differentiation within the NICU. Only babies within this category could get it. And that was so interesting to me because a few miles away, there's another hospital that lets anybody who asks for it get the human milk. And it's just like in the same area, there's two different policies. And it's so you can't assume as a parent that just because, like you're saying, find out what the facts are. Because if you can advocate for yourself to get that milk ahead of time, if that's really what you're committed to, it's so possible, because you may be in a hospital where they have donor milk, but they won't give it to your baby.
And this is a number of years ago, there was a parent who contacted us. She had a critically ill baby who was in the emergency room, and she was shocked to find out that this hospital hadn't set up their donor milk program. And she was very upset, and she absolutely wanted her baby to get donor milk. And she actually asked what were the local hospitals that did, in her area that had donor milk. And she moved her baby to another hospital. So I'm not saying that that's the right choice for everybody. And I'm not saying, that would be, I'm not saying I would necessarily do that. But, if you know your baby and you're advocating for your baby, you are the best advocate for your child and your baby. I mean, what would
it's hard because a lot of hospitals, they're not moved until they see the numbers. But I mean, these diseases that you're talking about, like a septic workup in and of itself, the cost of treating a baby with sepsis is hundreds of thousands of dollars, right? Like this is huge money. NICUs, like the cost of caring for these micro preemies or these very fragile premature babies are hundreds of thousands of dollars. And if human donor milk can prevent something as serious as NEC or as sepsis, I mean, that is not only saving a human life, which is invaluable, but it is truly saving tens of thousands of dollars, right? And then the other thing is
hundreds of thousands.
So Cynthia, if I'm remembering, the hospital I recently worked at, when parents wanted to take some donor milk home, we could help arrange that for them. And if I remember correctly, the cost was like $4 or $5 an ounce. Is that correct?
Not well, close. So we do have a program which not all our hospitals are using. We are actively working right now on getting this program online. So to have a secure online, so families can do their sort of new recipient registrations, from their phones while they're in the hospital. So it's less paperwork for the hospital. So we are actively working on that. But we do have a number of our hospitals, and that should expand when we get this online. That families, upon discharge, that they can work with their lactation consultant or the nurse to be able to make an arrangement. It's basically an agreement between the hospital, the family, and Mother's Milk Bank Northeast, so that the hospital and the family fill out some paperwork that gets faxed to us. The family goes home with frozen bottles of donor milk. The paperwork is sent to us. We charge the family's credit card, but the hospital is basically holding on to that milk and providing it to the family and then faxing us the paperwork for that. So, and we even provide these great insulated, basically grocery bags with zip up that have our logo on it for families to be able to take milk home from the hospitals, and that we're really trying to do whatever we can to help support breastfeeding. It's really, honestly, I'm going to tell you, if every mother or every parent was able to provide milk to their own baby and we were put out of business,
that would be a great thing. Absolutely.
Right.
That's okay. I'm going to get another job. I'm not worried about that.
Yeah. So the only thing I wanted to make a point about is that, sometimes people think if they're presented with the option of human donor milk while they are waiting for their own milk supply to come in and they're pumping and feeding at the breast. And there's a number of reasons. When I worked at a community hospital with healthy early term, late preterm, or even full term babies, we would use it sometimes for just some weight loss issues, a baby that had blood sugar issues, mom maybe had diabetes, or baby was a late preterm baby or an early term baby. So whatever reason, right? People think like, oh, I can't afford, let's say, I'm just going to say for the sake of this argument, $5 an ounce. Oh my God, my baby's going to be drinking ounces and ounces and ounces, right? Let me give you a more realistic picture. These babies that I'm caring for as a postpartum nurse on day 2, day 3, before the parent's own milk transitions to mature milk, for most people around sometime between day 3 and 5, let's say, I'm like the order would read from the pediatrician to feed the baby at the breast and then give 10 milliliters of donor milk after each feeding. right? And so let's say they're doing 8 feedings a day, or 8 to 10, say, that's like, 80 to 100 milliliters, and an ounce is 30, right? So that's like 3 ounces of milk per day. These aren't babies that are drinking gallons and gallons of milk per day, right?
One 100 ml bottle, and we charge our processing fees for, our processing fees for the 100 and 200 milliliter bottles are $3.97 per ounce. So, a 100 milliliter bottle, which is 3.4 ounces, is $13.50. So, for hospital costs where a medication may cost a baby thousands of dollars, $13.50 is pretty small. So, as I mentioned, we had one hospital for the well baby unit did the study, and they found that, the average baby was getting 200 milliliters. That's only $27 per baby.
Exactly. I mean, it
prevents so many issues.
They think it's going to be long term, right? Like, they're thinking, I can't afford this in the long term. What I try to help parents understand is if feeding your baby at the breast, or feeding your baby your own milk, whether it's exclusively pumping or whatnot, is your goal, because we're trying to help people meet their goals, right? So if those are your goals and your milk isn't quite transitioned yet, and your baby needs some extra calories, and we know that there could be some harm to just one bottle to their gut flora and their microbiome, right? Then we just need milliliters to get us over the hump.
Not
right?
really that expensive. And for families who do need milk, we do have financial assistance. I do want to draw attention. We have an amazing website. It's milkbankne.org. So, if you're interested in receiving milk, donating milk, for our financial assistance, please, I, advocate for everybody to go check out our website. Look on the financial assistance page. We do have financial assistance for babies in need.
That's amazing. Now, that brings me to my next question, because you mentioned that you mostly provide milk to states in the Northeast, but have provided milk all over the country as far as Hawaii. Did there used to be more milk banks? And, what happened? What's the history with that?
So, good question. So, within the Human Milk Banking Association of North America, there are, I think it's now 26, it could be 27, excuse me, independently running milk banks, but we all follow the guidelines of Habana. So in the early 80s, the country was hit with the AIDS epidemic, and that changed blood screening, it changed donor screening, and donor, it changed how we do everything. So there were up to the early 80s, there were, I think it was like 50 to 55 milk banks. Some of those were hospital-based milk banks. Some of those were really informally based milk banks, maybe someone collecting, I don't really know the details of it. So 50 to 55, AIDS epidemic hit, and almost all of those milk banks had to close down because of the screening process. I think about 6 or 7 milk banks survived that, and they came together, and these are milk banks in both the US and in Canada, and they came together to form the organization, the Human Milk Banking Association of North America, and they came together to develop, regulations, guidelines, protocols for the donor screening process, for how a milk bank needs to operate, for every aspect of what we do in the milk bank. They have provided amazing guidance to us, and I can't speak enough about that. And they continue to always be updating the guidelines and looking at things anew. So, and the donor screening process is based on blood screening. So, we follow many of the same protocols and guidelines.
So, the next question was going to be Jeanette's. We kind of already answered it. I don't know if you want to at least say that statistic, though, because I think that it is a really good one about how many babies.
Oh, yeah, we talked about it. The 700 to 900 babies would live.
That's a lot.
Right?
700 to 900 more babies would live if all NICUs across the U.S. used human donor milk. I mean, that's pretty incredible.
Yeah, and that's just the NICUs, with if you add in term babies and long-term risks, not necessarily of death, but just all the other risks that are associated with. There's actually a really interesting article out there that I think it might be the American Academy of Pediatrics put it out, or at least it's in their journal, I think, called the risk of not breastfeeding, I think it's called. I don't know, Cynthia, if you know that one. I'm sure
I
you
don't
do.
know that one off the top of my head, or I'm
Yeah,
not.
it's something. It's like the risks of not breastfeeding. I'll put it in the show notes. Risks of not. There we go. And so it talks about all the different associated illnesses, because we think, well, my baby didn't get breast milk and they're fine. Or myself, I'll speak to myself. Like, I wasn't given breast milk because my mother had some challenges with breastfeeding and didn't get the help she needed. And so I ended up with formula. And then there was I wasn't gaining weight well. And by 6 weeks at the time, this is a long time ago, but at the time I was gaining not enough weight. So then they decided to put me on something thicker. I forget what it was, whether it was evaporated milk or what it was. It was something very high fat. So then I was gaining too much. And so then they told my mother to put me on powdered skim milk.
Wow.
And in looking back with my health problems at this point, we think that because of that, I ended up having a lot of damage to my kidneys, which has led to lifelong problems. And I'm still at risk for various things and blah, blah, blah. So we have to
you've
wonder.
actually talked about that on this program before, about when you were pregnant, you had some issues with your kidneys.
And those health issues affected my pregnancies, or at least had a risk to affect. Fortunately, it didn't. We don't think. But yeah, it's just so, you think, oh, well, they turned out fine. It's like, well, yeah, but are they going to be fine later? We don't know. And ultimately, like we've said, you have to feed your baby with what you have on hand. And right now we're just trying to make sure that more people can get access to this and not feel like it's so weird. I work with a lot of families where at first they just think like, what do you mean getting milk from someone else? And I always joke with them, which I'm not really joking, but it's kind of a funny thing, to be like, do you have cow's milk in your refrigerator right now? And most people do. Or they used to before they transitioned to some other cool thing like oat milk now, right? But then I'm like, wait, so do you know those cows? Do you know the farmers? Do you know the thousands of cows that went into that one container of milk, of their milk? You don't, but you know the one that's sitting in your living room feeding your baby. Like, why not taste that milk, So it's just, we have these preconceived notions. And like Cynthia, you're talking about like the screening process. There are some people that are not eligible. So I don't know if you want to talk about that too. Like, how do you go about, besides the blood testing, like what kinds of things are you looking for?
So why don't I talk about the screening process? Why don't I start? I'll go from, why don't we follow the milk? How about we do that?
Yes.
I like that. Follow the milk.
Follow the milk.
That's a great bumper
like
sticker.
My 10-month-old, follow the milk.
That's a great bumper sticker. Follow the milk.
We have a page on our website that says follow the milk.
Oh, okay.
So let's start with the donor screening process. All right. So if somebody's interested in becoming a donor, I recommend that you go visit our website, milkbankne.org, and go to the donate page. There's a number of videos. Also, there's great videos on our website that show how the processing is done in the lab. So, but there's a page on donating, and it will tell the donor, here's like sort of the brief 4-step process of becoming a donor, and a paragraph on you may be eligible if, and there's reasons, who is an eligible donor, and you may not be eligible if. So if I'm talking about like who are donors, so donors are healthy, lactating women. They're not using recreational drugs or marijuana. They're not doing any illegal drugs. They're not smoking. They're not drinking alcohol every day. Those are some of the basics, okay? And we have generally 4, let's say, types of donors. The first one is, healthy mom with a healthy, full-term baby who has simply pumped more milk than her baby is going to use, and she has a surplus of milk, and she'd like to donate that to help save another baby's life. We're never looking to take, the parent away from the baby. We want the parent to spend time with their baby at the breast. That's really ideally. So we're looking for the surplus of the extra milk, not to say you should take an hour of your time away from your baby every day to pump for us. That's not what we're looking for. So, moms of healthy babies. We have another group, which are, parents of babies who are in the NICU. And they're often in the NICU for extended periods of time. And so sometimes all that parent can do is to pump milk, Unfortunately, there's not always enough kangaroo care in a lot of NICUs, so sometimes all a parent can do is to maybe pump milk, and honestly that's challenging because if you're not touching your baby, then you're not always producing as much milk as you might because you need that skin to skin contact. Often that milk is what we term preterm milk from a mom who's pumping in the NICU, and so many of our NICUs want preterm milk. And preterm milk is milk that has been pumped from when the baby was born up until, if the baby is born up to 37 weeks gestationally, okay? And anytime earlier than that, and it's the first 4 weeks of milk that has been pumped, and that is termed preterm milk. And for our milk bank, we don't make a cocktail; it's simply just the preterm milk is processed separately. So we have moms of healthy babies, moms of babies in the NICU, and we have moms who are I'm gonna cry every time I think about this. I cry. We have families who have lost babies. Quite a few families who have lost babies. And these families choose to donate milk in memory of their babies. It's unbelievable, just incredible that they're able to do this, and they want to save other babies' lives. So some of these families simply want to donate whatever milk they may have already pumped for their babies. Some choose to continue to pump so they stay as a way to stay connected to that baby who's who they lost. And they're just amazing. When we have, again, this is on our website, we have sort of a memorial quilt for these babies and these families. It's this beautiful quilt that one of my colleagues created. It's gorgeous. It's got a tree on it. And she's quilted these leaves. And so for every baby, who was lost and the families donating in memory of them, their name goes up on a leaf on the tree, and the family also receives a leaf. And we even have a closed private Facebook group for these bereaved families to be able to connect in with one another.
That's beautiful. That's amazing.
So yeah, and then the fourth type is sort of a newer type, is surrogate mothers who are choosing, I guess, instead of maybe, I don't know the details, but maybe instead of selling the milk to the family, they are choosing to donate to us. So it's really quite amazing. These donors are all of our heroes. So in terms of the donor screening process, so the first step is to go take a look at our website, as I mentioned, and to look at the page. You can do a little bit of self-screening about whether you think you'll be eligible or not. And then you will call our donor intake coordinators. And we have the most amazing donor intake coordinators. They are thoughtful and kind and sensitive. They are IBCLCs and LCs and nurses, and they can screen in Spanish. All of our materials are translated into Spanish, and we can also screen in Creole and Portuguese. They're just loving, wonderful people, and especially with the bereaved families who contact them. They will walk the donors through the donor screening process. So they're going to have potential donors, prospective donors will have a 15 to 20-minute phone screening with the donor intake coordinators. And then the donor intake coordinators are going to send that prospective donor a link to a secure website where they're going to fill in information. It's a fairly extensive health history questionnaire asking all of the questions that you want us to ask to make sure that that milk is safe. It's a lot of lifestyle questions. And they're going to sign consent forms so that the donor intake coordinators can reach out to the parent's doctor and the baby's doctor to make sure it is safe for that baby, for the parent to donate, and to also make sure that it is safe for anybody receiving the milk. We do need those healthcare providers to be involved in that. The donor intake coordinators will help the prospective donor to find a lab where they're going to have their blood tested. We're testing for HIV, HTLV, hepatitis, and syphilis. And also just to let people know that when we do the pasteurization process, viruses are killed. Most things are killed in that pasteurization process. So they're going to have the blood test, and then when it's time, they've gone through the whole screening process, and they've been given the go ahead to donate. Then there's different ways that they're going to get our milk to us. If they're local, they might want to drive it over and drop it off, and then they get to see the milk bank in action. It's great to come in and see the lab. People love to come in person. Well, not during COVID-19, but
as many things.
Yeah. Or they can drop off. We have, I think we have something like, I'm so sorry, I should have looked this number up. Maybe 29 depots. Maybe we're coming up on our 30th depot throughout the Northeast, where moms can go and drop off milk, and the depots are trained to accept the milk and store the milk and ship the milk to us. Or if mom would prefer to ship the milk from the comfort of her own living room, we will send them a box and give them all the shipping instructions to ship the milk to us through FedEx Priority Overnight.
That's so great. I looked into becoming a milk bank depot years ago when I had a different office than I have now. And the one issue with it was apparently, I think this, let me know if this is still the case, you have to monitor the temperature of the freezer like every day. Is that right?
Well, what we've provided depots with now is we've provided them with a professional grade thermometer, which tracks the temperature. I think it's every 3 minutes, every 5 minutes. However, we do provide milk to New York, and the New York State Department of Health does require for any days that somebody is in that depot that they need to write down the daily temperatures.
Okay, so it doesn't anymore require someone to be there 5, 6, 7 days a week.
It's something that we should talk about.
Yeah. It might still, yeah.
There's many different reasons why different organizations, would be great for depots, and some reasons why not. So it's really on a case-by-case basis.
But that's also explaining why it's amazing that you have 29, if that's the current number, right? But it's not more than that, because it does take a bit of commitment and technology to be able to be a milk depot.
It takes definitely some commitment. We also don't want to have them too close together, because you don't want to take, although I think most families might not really want to drive, because they can ship to us FedEx. Other milk banks require their donors to ship the milk using dry ice. Because we are in the Northeast and we pay for, I think maybe possibly a more expensive shipping so that it comes earlier in the morning, we don't require the donors to ship using dry ice. So often donors would just rather have a box shipped to their house. So when we have depots, I feel very strongly that our depots serve two missions. One is to accept, to collect the milk and to store it and to ship it to us in accordance with our guidelines. But equally as important is their being our partners in the community, our right hand in the community, and that they can do education and outreach, and they can let moms know that if you have extra milk, that you can donate that and save a baby's life. Because honestly, I don't want to keep hearing that, oh, I had that freezer full of milk and I threw it away.
So. Oh my God, I know. Actually, I wanted to ask you about that. So before I learned more about it, through Jeanette, through being a nurse, through working at a hospital that used it, I assumed that before you could donate milk, you had to set the process up ahead of time before you even started pumping any milk, because it had to be saved in a certain way or whatnot. So my question is, if somebody has this freezer full of milk that they've never thought about donating, but now they're like, what am I going to do with it? Did they have to set something up with you ahead of time, or can they start that process while that freezer's already full?
No, they can start the process anytime. I think usually, and again, I'm not one of the donor intake coordinators, so anybody who's interested in becoming a donor, please visit our website, milkbankny.org, contact our donor intake coordinators. The phone number's right there on every page of the website, and they can give more information. But I think often moms, if you have a baby, I think we're saying, spend a month with your baby, spend a month, take care, make sure you have that extra milk, your baby comes first.
Of course.
Baby comes first.
But if the milk has already been pumped,
then they'll call, and the donor intake coordinators will walk them through and ask them some questions, and to make sure that, that they've pumped and stored the milk and I don't remember. I wish I knew this, and I could certainly get back to you with the information about how quickly the milk needs to be put into the freezer. I'm not.
Oh, sure. Yeah, as long as the milk, the way they've been doing it.
Yep, the donor intake coordinators, we'll talk to them and we'll work it all out with them. I'm not a donor intake coordinator, so I'm not an expert in that process.
Right. So, Cynthia, let's talk about how the milk is treated at the milk bank before it's being given out to babies. Because as you've described, you are treating all of the milk as if it was going to go to the most fragile, sickest baby. So obviously you take this very seriously. Can you tell us how the milk is treated?
Yeah, so you can follow the milk. So, and I want to also, yet again, I'm going to talk about our website, milkbankne.org. There are 3 videos on the website that you can watch, and you can see the processing of the milk. So it's very informative, and this is what I would call the sexy part of our milk bank, watching the lab process. So milk comes in, and most of it is coming in, via FedEx in the FedEx boxes. So when the lab brings that in, there's a whole process for checking that milk in and for logging the milk in. And they will go through, with every donation, the lab staff will go through every single, pumping bag or snappy bottle, and they are checking, to make sure that it's from that mother, to make sure that there's dates written on when it's pumped, it's organized by dates. To make sure that if there's notes in the donor's account or the donor's file that there are dates that we shouldn't, she was on X medication from this date to this date, that they're not, accepting any milk from that. So they go through it very, very carefully. And then that milk is then, the milk arrives frozen. It is logged in, it is put into the freezers. And then each day when the lab is processing milk, the day before, they will pull the milk and they will thaw the milk on trays in the fridge the night before. So then when they come into the lab, it's everybody's scrubbed up and they have, the caps on and masks on and gowns on. They're very, very careful about it. And they empty all of the pumping bags and the bottles. It goes through a filter and it goes into these large beakers and it is mixed up. So all of the milk, so when we are processing milk and it's cold, we are batching together. We are pooling milk from usually anywhere from 2 to 5 different donor mothers into one batch of milk. So you want that because really, basically, the more donor mothers, the more different milk from different mothers you have in each batch, the wider range of nutrients and calories and macronutrients. So that's great. So, the milk is pooled together, it's mixed together, it is poured into smaller flasks, and those are poured those are poured into bottles. We have 3 different sizes of bottles. We have 50 ml bottles, which is 1.7 ounces. And those are really just for generally for neonatal intensive care units or hospitals that maybe have very few babies that will be on the milk. We also have 100 ml bottles, which are 3.4 ounces, and 200 ml bottles, which is 6.8 ounces. And the 100 ml bottles and the 200 ml bottles are the bottles that families would order to have at home with them. We do need to charge a little bit more for the 50 ml bottles simply because it takes us double the time to process them. So the milk is poured into the bottles and they are capped and they are put into trays, and all the bottles are labeled and they are put into trays, and those trays are placed into the pasteurizer. All Habana milk banks use the Holder method of pasteurization, and it is the gold standard of pasteurizing milk. It is actually how we pasteurize, how the dairy industry uses a form of the Holder method of pasteurization for cow's milk to drink that you have in your fridges. And so the milk is placed in the pasteurizer and heated up to 62.5 degrees Celsius for exactly 30 minutes. It is immediately, you can see the lab text in there with, all the timers. They're very, very careful. They're amazing. And they immediately take the milk out of the pasteurizer, and immediately it's put into an ice bath. The milk is then, the bottles are wiped off, put into different trays, and immediately put into the freezer to refreeze. One bottle from every single tray is sent to a third party lab for testing. All of our testing, whether it is the blood testing, whether it is testing the raw milk, we test the, for mothers who are donors who are sending milk to us for the first time, we test their raw milk. And if they continue to donate, we test the raw milk every 3 months. So for blood testing, the raw milk testing, and the processed milk testing, all of that testing is done at third-party labs. We don't ever want there to be a conflict of interest. We don't do any of that in-house. So, once we get the test results back from the lab, then that milk is good to go and is good to be shipped out to hospitals, neonatal intensive care units, well baby units. We have outpatient dispensaries. We're going to have our 5th outpatient dispensary open up. So there's, there may be one in your neighborhood. Some of them had to close for COVID-19 temporarily, but they should be opened again. Or, families can order from us directly. They can get milk for the hospitals who use our program where they can send families home with milk. They can get milk from there or from the outpatient dispensaries. And you can find out much of this information from the websites.
When I hear the word dispensary, since we're in Massachusetts, I think of something else. But similarly, wouldn't it be lovely if there were so many enough dispensaries that there were long lines outside of the human milk dispensaries because so many people wanted to go get that milk?
I think we're probably going to rebrand that, but really they are dispensing,
right,
pasteurized human milk. So I think we're thinking about rebranding, but who knows? I don't know. I shouldn't say that here. So
yeah. So who is eligible? Like, how do you figure out, we talked about babies in NICUs, and it's not every baby in a NICU that's eligible. And then we've talked about parents who have full-term healthy babies in a hospital, as well as the families in the community who might want it. So how do they determine who's eligible for that?
Great question. In the hospitals determine, and each hospital has their own protocols and policy for who can receive milk. And I can educate, I can connect hospitals in with each other, but each hospital makes that decision. And as you've mentioned, some hospitals are only providing milk to certain babies up to maybe 32 weeks or 34 weeks or 36 weeks in the NICU. Other hospitals are providing milk to every baby, who needs it or whose family wants it. So it is definitely a range. Families who are going home, outpatient families, as we, usually describe them, families do need a prescription to order milk. Habana has a new guideline where families can get up to 40 ounces of milk with no prescription. So that's maybe for our 100 ml bottles, that's maybe 10 or up to maybe 12 of the 100 ml bottles. But we do need a prescription. More than that, and I think that's actually that's a good guideline, because we do want to make sure that the milk is going to babies and maybe not to someone who is pumping iron and thinks that human milk will, improve their muscle strength. So we do want to know that.
It also shows doctors of the babies how committed some of these families are, and keeps it on their radar so that they can think for maybe another family, oh wait, I just did prescriptions for human donor milk. Would you want that? Do you want to talk about that? So I think it elevates the thinking about that amongst the medical community too, which is always a good thing.
And we tried to make it easier. We actually created a prescription form that most people use, our prescription form, because if a doctor or a nurse or whoever has prescription writing privileges hasn't written one, they don't know what to put in it. So we've tried to make it easier by creating one, which most of them use, and it just makes it a little bit more simple, and they understand why, the whys and the wherefores of handling that. There's a range of why families, outpatients would get milk, parental health complications, double mastectomies, Same-sex couples can't provide milk. Baby has a cleft lip or palate. There's so many. Baby has GI issues, and mom has a low milk supply, and there's so many reasons. Just to that mom isn't making enough milk right now, wants to keep baby on a human milk diet, and all of those are valid reasons for getting milk.
Yeah.
There are so many benefits to the human milk for, like we talked about, very young, fragile, preemie babies, but even full-term babies. Now, when I worked at the community hospital, we would sometimes have premature babies born with us that we couldn't keep with us because our well baby nursery was not a NICU. Right, a neonatal ICU. And so the large, tertiary academic medical center would send their NICU team to our community hospital to pick up those babies and bring them to their NICU. During that time, it's, chaotic. This parent has just had an unexpected preterm delivery at a community hospital. Things are really crazy, but the NICU nurse practitioners would often, as they were packing up the baby and getting ready to go, say, we really would like to give your baby human milk when they're able to eat. Would that be okay with you? And not an ideal time to be talking, having this conversation, right? And sometimes people would say, no, you can just give them formula. And so later on, when things weren't so chaotic, I would often ask, the nurse practitioner had offered human milk to your premature baby. Did you have any questions about that? And many times they said no because they assumed that was going to be an outrageous cost to them, and that they were scared in the moment. They were like, no, I can't process this right now. So when a baby in the hospital receives human donor milk, who pays for that milk?
So that's a really good question. When a baby is receiving milk in the hospital while the baby is an inpatient, the hospital pays for it. It comes out of whichever budget that it may come out of. It could be, that NICU's budget or the baby, mother baby unit budget, or, out of the pharmacy budget, or, the blood bank budget. It's stored, it's handled differently in every hospital is different. But the hospital pays for the milk when it is given out to the baby there. At least that is my understanding. And maybe it could be different someplace. One other thing I just want to touch upon, there are times when hospitals are suggesting to the family that they use donor milk, and the family will say no. And it may or may not be because of cost, but sometimes there's also what we call the ooh yick factor, that families will say, ooh, yuck, I don't want to use milk from another mother. So, there's a number of ways to address that. And this is part of why I do so much education and outreach to hospital staff, is because the programs, what I have seen is that the hospital programs that are the most successful are those where the staff understands the most about our milk bank and about why donor milk and the donor screening process. So if you have a family, I train them on how to talk to, and I talk to them about how to talk to families who may have that ooh yick factor, or who have religious issues about why they think that they shouldn't use donor milk. And if a family is comfortable with the idea of blood donation and receiving, donated blood, the screening process for a milk donor is the same. It's based on the blood screening with additional tests, additional screening, because it is human milk and not blood.
But also, human milk is actually food. It's different in a way. I mean, it is different than blood, right? It's related, but
yes,
it's a food. And so what are some of the other things that you might encourage a parent to think about when it's a religious or an ick factor, as you say?
Well, the ick factor, we talk about, I would invite them to visit our website and to take a look at the donor screening process and to see and to look at the videos. We have this video on our website, and there was a parent in there with her baby, and when she was in the hospital with her baby was in the NICU. Baby was born early. I hear this all the time. This is a story we hear all the time, and I love it. And there's actually a new blog on our website specifically addressing this scenario over again, where The baby was in the NICU for a little while and received donor milk in the NICU because mom's milk wasn't in. And when the mom, when the staff asked the mom if she would like to use, pasteurized donor human milk, she said, of course, like, why wouldn't I? Because the donor is just like her. Like, it is somebody who has extra milk who wants to help support and take care of another baby. So it seemed obvious to her. And then her milk came in and she moved on to become a donor for us. And that happens time and time again, where someone becomes more motivated to become a donor because their baby received milk received donor milk in the hospital for a period of time before their milk came in. So that's just a beautiful story. So I think learning about that, understanding that pasteurized donor human milk is really now is just part of a normal breastfeeding support. For religious reasons, I don't want to go into too much detail, but for the Muslim community, there is the concept of milk kinship. For Orthodox Jewish people, there's the idea of keeping kosher is the milk kosher. And I'm sure other communities have other reasons. So within Judaism, because I'm Jewish, so I can speak to that more. We have a concept of what's called pikuach nefesh. Saving a life is the most important thing above almost everything else. So if this donor milk is life-saving, is going to bring great benefit to your baby, then that is more important than that is more important than anything else. So for families with religious concerns, what I recommend to the hospital staff is that they talk to the family, that they recommend that the family talks to their religious leader, whether it's their imam or their cleric or their rabbi or their priest or their minister, that they talk to their religious leader. And I've even suggested that the hospital staff, whether it's the doctor, neonatologist, or a nurse or the lactation consultant, speaks to maybe, if possible, could speak to the religious leader and let them know the importance of using donor milk. Because we have had people contact us and say, oh, I'm not sure I can do that for religious reasons. We recommend that they contact their, religious leader, and they've come back to order milk from us.
Speaking to any nurses that might be listening to this podcast, one thing that I know is a barrier to patients who are willing to accept donor human milk for their babies in the hospital is that the nurse is intimidated by the process, because it's very easy to go to the formula cabinet and grab a bottle of formula, shake it up, throw a nipple on it, and give it to the baby, right? So what's awesome about the human donor milk process is it's really super easy. So there's generally a designated refrigerator and freezer, usually in the nursery, for all of the human donor milk. There is a special human milk warmer that you simply pour out the amount of milk that you need to give to that baby. Let's say 10 milliliters, let's say it's 12 milliliters. You pour it into a little container. You pop it in the special machine that's about this big. You go boop, 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 and you tell the machine how many milliliters are in the bottle, and then it press start, and it says, okay, 7 minutes, let's say it's going to heat this milk up, and then I just chart for 7 minutes until it goes doodle-doodle-doop, and then I bring that milk to the parents. So it seems very intimidating, but it's really super easy. And the other thing we have to talk about as far as the X factor is that we have a long history in this country. I'm 37, my grandmother's 86. In 1959, when she had her first baby, even though she was the youngest of 9 children, all of which were home birthed and breastfed by my great-grandmother, born in 1898. My grandmother was born in 1933, had her first baby in 1959, and the crib card on my Uncle Mark's crib said, Carol's corn syrup. What's best for your baby, right? Because that's back in the day that they were cooking their own formula, which actually one of the ingredients was corn syrup, and actually in many formulas, one of the ingredients is still corn syrup. And so she was told, like actively discouraged from breastfeeding because that was for poor women, that was for women of color, that was for women that were otherwise not like her, right? White and middle class and living in a suburb. And my grandmother had to fight to breastfeed her baby, right? And what they did was the nuns only brought her the baby every 4 hours for 20 minutes and then would take the baby back away. So we have a long history in this country that has ingrained in our brains that human milk is icky, right? And even families that are breastfeeding babies now in 2020 are being told at some point by many of their well-meaning family members, well, this baby is 6 months old, 9 months old, 12 months old. Aren't they too old for human milk now? Because there's this, again, X factor to it. But biologically speaking, human milk is tailored for human babies and is, if at all possible, able to be given the best for their bodies, their brains, their guts, and a whole host of other things. So, if you're ever interested in learning the history of, breastfeeding in general, breastfeeding in this country, whatnot, it's fascinating. But a lot of that ick factor from family members might come from that as well. And so we have to educate people, that it's just the ideal food for that baby, and it is carefully, scientifically, compassionately treated to be the safest that it can possibly be.
So there is a video that I have shown when I did a education and outreach, when I did a presentation for a nursing school. I played a video because a lot of these nursing students didn't know anything about this. And the video, it's on YouTube, and it's called Growing a First Food Movement Coming Together in Support of Breastfeeding. And it is a great video. It lasts a few minutes. I can't recommend it enough if people want to understand the history of how formula took over and became so prominent and what happened to breastfeeding in this country.
Yeah, a book that's really great, a relatively new book, is called The Big Letdown. It's also a really good option.
Yeah. And she's a fantastic author.
And speaker. So, she's an amazing speaker.
Excellent book.
And in terms of staffing, I mean, that's part of, again, I keep repeating this, why I go around and I do so much education and outreach, because we have had families who have contacted us and made comments that the nurse in the hospital, so when they asked about using donor milk, the nurse said things like, well, I don't have a baby, so I can't tell you about it. It's like saying, I've never had pneumonia, so I don't know if you should use an antibiotic, so... Or the nurse would say, ooh, yuck, I wouldn't do that. That's gross. So, so much of when I go to hospitals and I do these presentations for the staff, I got to tell you, so often we've finished and the staff comes up to me and says, one of the nurses comes up to me and she says, I really was not supportive of your setting this program, of this program being set up here, but now you've changed my mind. Because all anybody needs is some understanding of why human milk is better than formula and what is the process that we do at the milk bank, because people just don't know. Nobody knows what a milk bank is. So that's
But also I think a lot of parents don't know that as nurses, doctors, midwives, that's not even part of their training in the first place.
They get very little training in this.
Just about breast milk or breastfeeding or lactation or infant feeding. So now here you come saying, well, let's give somebody else's milk to that baby from a bank where we've processed it. It's like mind blowing. You're like, wait, I don't even understand why this matters. So it's awesome that you're doing what you're doing.
And you're right, Cynthia, about when people see that it's just regular, everyday, altruistic people that want to donate this milk to help other babies, that it makes a big difference. So, I know that when I was counseling patients as a hospital-based nurse, I would talk about human donor milk and say, and moms like me who had extra milk, like to give their milk to help other babies. And like, oh, moms like you? I thought it was, weirdo people. It's actually just, oh, you seem normal. So it's true. It's just regular, everyday people who really just want to make a difference for other families and other babies. And they're getting no financial incentive to do this whatsoever. This is something that they just donate out of the kindness of their hearts to help other people.
We don't even send out onesies. We don't want their, we don't want to say that somebody who donates, 6,000 ounces, that milk is more important to us than the woman who donates 150 ounces, because that 150 ounces is like this gift of the heart. I mean, human milk is liquid gold. It is liquid gold, and it comes from the heart. So all of our donors are our heroes. They're just, incredible and inspiring.
I was just doing a calculation to try to figure out, like, what's the average amount of time that somebody would put in to get 150 ounces, you know?
Really depends.
It depends, but, it's
Some
a few
mothers
hours, but
produce like
or
this
more.
insane amount of milk, and they could do it like that, and they
Right.
donate thousands and
Right.
thousands of ounces, which they're amazing, but that person who, is struggling, or maybe their baby's eating more, and this is whatever, like that 150 ounces. Think about, in a NICU, babies may only be getting, those micro preemie babies may only be getting 5 milliliters or 10 milliliters of milk per feeding. There's 30 milliliters in an ounce. Think of how each of that 1 ounce can feed so many babies in a NICU. It's just incredible.
Well, it's also the amount of time it takes to pump, on average, say 15, 20 minutes, and say somebody does get 3 ounces in that amount of time, which is a, reasonable number, that's still a lot of time that they donated their time to make that milk to give it to you. And if you had asked any person on the street, hey, can you volunteer 3 hours today? Many people would be like, I'm not giving you 3 hours. So it's such a gift that someone took the time to go, I took all that time to make that, and now I'm going to give it away to somebody.
And it is precious. And I want to let, everybody out there know who's either donated to us or is thinking about donating to us, that we treat that milk preciously, that we care very much. We do know for, every parent out there who has pumped and spent that time, and let's just face it, pumping is just not all that pleasant,
Although I really have some good strategies for making it more entertaining.
Oh, good.
But people can contact me separately for that if they want to
know. So is there a way for families to get milk from the hospital to take home when the baby is discharged? Something called the Special Assistance Program, I believe. And can you share a little bit about what that is?
Sure. So we have been offering to hospitals, and not all hospitals do this, but more and more of them are, I have hospitals all the time taking on this program where when families are being discharged, the hospital and the family fills out some paperwork. The paperwork is faxed to us, and families can go home with milk. We charge their credit card at the milk bank. However, as a nonprofit community milk bank, we believe the equitable distribution of pasteurized donor human milk is very important. And it shouldn't just be the people who have money who can access the milk to go home. So we do have financial assistance. And if people are interested in finding out about our financial assistance, they should absolutely visit the financial assistance page on our website under Receive Milk. The financial assistance and the idea of having donor milk for the largest majority of people is not a long-term ongoing. It is a short-term, temporary solution until mom's own milk comes in, or until baby's system has developed enough to be able to handle maybe a specialized formula.
Yeah, it is important for families to know that, if they're considering using some human donor milk at home, and I also told this to patients when I worked in the hospital, this is a short-term solution. It's not something that's going to be a long-term thing. We're hoping to bridge the gap from when your baby can get human milk while your own milk comes in, while you're working with a lactation consultant to increase your milk supply, pumping or getting a better latch, or until a baby can receive a specialized formula, right? So this isn't something people, if you're intimidated by the cost, is not a long-term thing for anybody. It's something that is a bridge that can be very valuable to you and to help you meet your human milk feeding goals. So I think that's important for people.
Yeah, I think that is important. I agree.
So maybe as the last question, unless we come up with something else. So as a milk bank, do you guys need financial donations or volunteers other than milk donors?
Absolutely. I mean, obviously the milk donors are our biggest group of volunteers. We absolutely love giving financial donations. You can, give a general donation, or you could say that you specifically want the donation to be targeted for financial assistance for families in need. You can absolutely do that. Whichever way it goes, any money we get in is absolutely helping babies in need. So there's, we're a nonprofit milk bank. We're not, going into Tahiti with them.
And is the milk bank receiving like grants and funding from other places, or is it just the money that you get for the actual milk that pays for things?
We receive some financial donations, but I would say that the way that we are primarily self-funded through charging processing fees for the milk. I mean, again, we never charge for the milk itself. It is all donated by the heroes that are donors, but we do charge the processing fees because what we do is extremely expensive and time consuming. I mean, just the testing of the milk and the blood itself is extraordinarily expensive. I think it costs us, around $200 minimally for every time someone takes a blood test.
So someone's insurance won't pay for that blood test either, is what you're saying?
No, we don't charge. We pay for all of that. Donors never incur any costs with the donation process. We cover all the costs. Insurance isn't covering it. We as the milk bank are covering it. Some labs that are doing the testing or the blood draws, sometimes will do it complimentary because it is a donation to the nonprofit milk bank, but for the most part we pay for that, and it is extremely expensive. We depend heavily on our volunteers. We have the most amazing volunteers at our milk bank. Some who come in and make packets or label bottles, or sometimes our depots are all run by volunteers, and sometimes some of the depots could use some additional volunteers. Sometimes we have individuals who come in on a regular, maybe a weekly or monthly basis. We have groups that come in, and they come in as a whole group and they get a ton of stuff done. And really, I can't say enough that every little thing that anybody does in our milk bank, whether it's a volunteer or, the staff admin or somebody who's labeling bottles or making packets to go to the donors or making packets for new recipient families, we couldn't function. We couldn't get milk to babies in need if someone wasn't doing that work. So there's nothing that gets done in our milk bank that isn't important. There's every little step is incredibly important to getting milk to the baby in need. So we have volunteers who come in and, do packets and label bottles and put together blood kits and all of this stuff. We also have more skilled volunteers who want to do something more in depth, who have special skills, and they are able to maybe do some more stuff on the computer or help us with projects. We've had some art projects done, like this beautiful map that was created as like a picture in time of where all our milk was going.
Oh, wow.
So that was great. It's really amazing. And if people would like to learn more about becoming a volunteer or giving a financial donation, again, I'll send you to our website, milkbankne.org, and all the information is there. And we have a whole volunteer intake form now, which is incredibly helpful.
You're definitely an excellent representative. Your enthusiasm is infectious, for sure.
I agree.
Thank you. Well, we have an amazing, amazing, amazing team at the milk bank. Everybody who's there cares deeply about what we do, and everybody who's there cares about the mission, about saving babies' lives.
Wow. Well, on that note, thank you for sharing so much in-depth information on such an important topic and taking your time out of your busy day with triplets and working from home during this time to hang out with us and share all this. So I hope more people are inspired to donate or to ask for milk, because that's why you do what you do, is to have more people ask for milk and get more babies to get that milk. So that would be awesome. So thank you so much. And like you've said, if anybody wants more information, the milkbanknortheast.org is where they will get it.
Milkbankne.org.
Oh, Nanny. Ooh, see? Good job. You said it, 8 times in this whole thing, and I still got it wrong. So milkbankne.org. Awesome. All right. So we hope that anybody watching will join us for future shows on babiesincommon.com/show. We have many topics and new guests coming up, and they're listed as we get them on the website. And our show is available as a video recording as well as a podcast. So if you want to listen to the podcast, you can do that through our website or through Spotify or Apple Podcasts.
Yes, and if you learned even one tiny morsel of helpful information today, please don't be stingy and text a friend, tell them about our podcast or our video cast. And if you'd like to laugh your stretch pants off while learning about babies, birth, breastfeeding, please take a class with Jeanette or I, babiesincommon.com. They're all virtually now during the time of COVID-19 through Zoom, so you don't even have to leave your own house. Virtual feeding consultations and weekly feeding groups called Breast Milk and Conversation are also available through Zoom. And if you follow us on Facebook, Instagram, always posting great articles, videos, and resources to help you rock your birth and thrive as a new parent.
Awesome. And our next episode will come out after June 17th. We're interviewing our friend Dina Fraze, who's a home birth midwife, and she'll be talking about birth as a physical, emotional, and spiritual journey. So very different than today, but also extremely important. And we hope you'll check that out. After all, we are a community for you because we all have babies in common.
Yay! Thank you, Cynthia.
Thank you. This is my pleasure.
Thank you.
Delightful.
Awesome. All right.